Immune system is the integrated body system of organs, tissues, cells, and cell products that differentiates self from non-self and neutralizes potentially pathogenic organisms or substances. This consideration is true. Antigen is any previous substances, including toxins, bacteria, and the cells of transplanted organs that, when introduced into the body, stimulate the production of antibodies. It is also called an allergen or immunogen. This consideration is true. Antibody is a protein substance produced in the blood or tissues in response to a specific antigen, such as bacterium or a toxin, that destroys or weakens bacteria and neutralizes organic poisons, thus forming the basis of immunity. This consideration is true. Innate immunity refers to antigen non-specific defense mechanism that a host uses immediately or within several hours after exposure to an antigen. This is the immunity one is born with and is the initial response by the body to eliminate microbes and prevent infection. Adaptive or acquired immunity refers to the antigen specific defense mechanism that takes several days to become protective and are designed to react with or and remove a specific antigen. This is the immunity one develops throughout life. Allergic reaction is a local or generalized reaction of an organism to internal or external contact with a specific allergen to which the organism has been previously sensitized. Immediate allergy reaction or type 1 allergic reaction is an allergic or immune response that begins within a period lasting from a few minutes to about an hour after exposure to an antigen to which the individual has been sensitized. Delayed allergy reaction or type 4 hypersensitivity reaction is an allergic reaction that becomes apparent only hours after contact. Immunodeficiency is a disorder or deficiency of the normal immune response. Anaphylactic shock is a severe, sometimes fatal allergic reaction characterized by a sharp drop in blood pressure, urticaria, and breathing difficulties that is caused by exposure to a foreign substance such as a drug or bee venom. After preliminary or sensitizing exposure, this consideration is true. H1 histamine receptor subtype is distributed in smooth muscle, endothelium, and brain. H2 histamine receptor subtype is distributed in gastric mucosa, cardiac muscle, and mast cell and brain. Most tissue histamine is sequestered and bound in granules in mast cells or basophils, cell bodies of histaminergic neurons, enterochromaffin-like cell of the fundus of the stomach. These categories of histamine H1 antagonists are noted for sedative effects except piperidines, that is loratadine and fixofenadine. Which category of histamine H1 antagonist is noted for the best antiemetic action? Ethanolamines, that is amino alkyl ether, that is doxylamine. These categories of histamine H1 antagonists are noted for the anticholinergic effects except piperazines, that is hydroxyzine and cyclizine. Which category of histamine H1 antagonist is noted for the alpha adrenoreceptor blocking effect, that is phenothiazine, that is piperazine and promethazine? Which category of histamine H1 antagonist is noted for the highest local anesthetic effect? Phenothiazine, that is promethazine. Which category of histamine H1 antagonist is recognized for a second generation antihistamines? Piperidines, that is loratadine and fixofenadine. These histamine H1 antagonists are recognized for as a second generation antihistamines except suprastine. Which of the histamine H1 antagonists is noted for the serotonin blocking effect, that is cyproheptadine? Which of the following histamine H1 antagonist is a long-acting antihistaminic drug? Diazolein. Which of histamine H1 antagonist is noted for the ulcerogenic effect? Diazolein. Indication for administration of histamine H1 antagonist is prevention or treatment of the symptoms of allergic reaction, motion sickness and vestibular disturbances, nausea and vomiting in pregnancy. Indication for administration of histamine H1 antagonists are the following except management of seizure states.